This is the fourth comic for the European Society of Endocrinology and Endocrine Society Joint Clinical Guidelines for Glucocorticoid-induced adrenal insufficiency. This video will focus on diagnosing and treating glucocorticoid-induced adrenal insufficiency. Glucocorticoid-induced adrenal insufficiency should be considered in patients who are currently or recently using non-oral glucocorticoids and show signs of adrenal insufficiency. Secondly, it should also be suspected in those using multiple glucocorticoid formulations at once or those on high doses of inhaled or topical glucocorticoids. Additionally, it should be considered in patients using inhaled or topical glucocorticoids for over a year, those who had intra-articular glucocorticoid injections in the past 2 months, and those on strong cytochrome P453A4 inhibitors. If a patient with a history of glucocorticoid use shows signs of Cushing's syndrome, it should be assumed their HPA axis is fully suppressed. They will need to be managed accordingly. Morning cortisol measurement can help with this. It can distinguish between adrenal insufficiency, which shows low cortisol, and recovering adrenal axis even if Cushingoid features remain. The renin-angiotensin-aldosterone system maintains mineralocorticoid function. Therefore, fludrocortisone is not recommended for patients with glucocorticoid-induced adrenal insufficiency. For patients with recent glucocorticoid use who haven't had biochemical testing, provide stress dose coverage with oral glucocorticoids for minor stress. This is only if there is no hemodynamic instability, severe vomiting or diarrhea. On the other hand, parenteral glucocorticoids should be used for moderate to major stress, procedures under anesthesia, when oral intake is not possible, cases of hemodynamic instability, and if the patient has prolonged vomiting or diarrhea. For moderate to major stress, procedures under anesthesia, when oral intake is not possible, use parenteral glucocorticoids. They should also be used in cases of hemodynamic instability or prolonged vomiting or diarrhea. If a patient has hemodynamic instability, vomiting or diarrhea, consider adrenal crisis. This requires immediate treatment with parenteral glucocorticoids and IV fluids. Looking ahead, we need research to define the real risks of adrenal crisis, understand the emotional impact of glucocorticoid withdrawal, and develop accurate clinical assays. For more information, please scan the QR code.